Welcome everyone to the Gamification Report, episode 19. We're going to have a little short episode today to clear up some interesting questions that have been coming up in our LinkedIn posts and our feeds, and that is, does VR-based training actually work? We're seeing a lot of people developing virtual reality applications, but does it work for teaching and learning? And that's a big question and not as easy to answer as you might wish. Let's start off by looking at VR simulations and users' knowledge, attitudes and values relating to psychosis. This is a paper by Nicholas J. Formosa in 2017. And what he did in this study is he took a sample of 50 participants from the general public and undergraduate programs, and they completed pre-test knowledge, exploring knowledge of diagnosis, attitudes, and empathetic and understanding about psychosis, about people that were schizophrenic. And then they were exposed to an immersive VR simulation of a psychotic episode, so they actually got to be the part of the schizophrenic. And then they completed the original measures with the addition of a user experience scale in which they looked at fidelity, immersion, presence, and user buy-in. So in other words, they're looking at, can you in VR create empathetic or understanding responses to someone with a disorder like psychosis? So let's see what they found. They found that the participant scores were significantly enhanced at post-test across each of the outcome measure, with significant correlations between a number of gain and user experience scores. So essentially they found that when you were able to be in the state of being a psychotic yourself, you were able to understand psychosis much more. And this is the kind of VR experience they had. On the upper frames here, you can see that they have a normal room, but here they've encased a kind of menacing, shadowy figure in the room. And this is the type of thing you might see, these heightened kind of red colors, heightened color intensities, heightened, geometric relationships, what psychotics in a bad episode would report. So you got to experience the psychotic element in the virtual state. And I found that was very, very interesting. Let's look at another area where VR seems to hold some good value. So not only can we have empathetic responses, but it appears that we can have procedural, what's called tacit or procedural learning responses. This is ophthalmology in VR, done by Danny Su-Chung Ing in 2018 in his team. And the objective here was to identify residents' barriers to learning phacoemulsification surgical procedures, and to see if they could learn these procedures on the eye using VR. And the conclusion was that residents that had done a simulation training in VR had a higher confidence in performing the most difficult tasks. And we see this again and again in the medical literature. If surgeons are allowed to go in, there was a great study done with second-year residents we reported on previously, where you can actually go in and practice the surgery. Your confidence, especially in residency training, is much higher when you get into a real body. So VR obviously is working and learning in this very, very good. Another study we looked at had to do with VR and pain control in children. So there's a lot of medical procedures in which patients remain awake during procedure, and they feel pain and they remember the pain over. So inadequately controlled pain using medications is a worldwide medical problem. So having patients conscious and feeling pain during medical procedures, as you can imagine, is very problematic for children, where they might need procedures such as large severe burns, where they have to debride the wounds, remove old dead skin, a very painful procedure. And you can imagine for a child the hell of going through this. So in order to look at this, they began to build different applications. So the first one was called Snow World, and that was the first VR environment created for virtual reality. So basically you're playing an immersive game while they're debriding you. And the idea is that your attention can't be in two places at once. So by focusing on the game element, the pain was decreased in children. This is the idea of distraction, that is drawing attention away from primary task to another stimulus. There's other term, and this is called virtual reality analgesia, which is psychological techniques based on distraction. And so there's lots of elements here. They talk about virtual environments, which I think you're familiar with, and the idea of presence. And that is a subjective perception in being in a virtual environment, living a realistic experience. How much presence is there in this distraction? And then procedural pain, of course, is that which we are trying to treat. So in this case, they found very effective pain relief in debridement, and Snowflake and Snow World have been used for a number of years for this reason. Patient education. This is a work by Yobeli Jimenez in 2018, and this is where they took a group of breast cancer patients, recruited into a control group, 18 of them, who underwent standard education packages at a cancer therapy center, and then they had a virtual reality education training group of 19. And the virtual reality group has attended a virtual reality education session in which they talked about planning and treatment. And they completed questionnaires at 4 time points throughout the treatment, with subsections on treatment experience and anxiety. Now, they found here that both groups' anxiety level was highest at 0.1. That's after the initial radiation oncologist consultation. So you see the doctor, they talk about the cancer. Well, your anxiety is going to be very high. And there was a gradual decrease observed before stimulation. As you get used to it, I suppose, there's less fear associated. However, the virtual reality group, and this is important here, with knowledge across scores, were statistically significantly higher than those of the controls. So following virtual reality education, people were able to understand cancer more effectively and able to respond to it. So here's another area where VR is of great value. We don't hear much about it in terms of patient training. Here again, coming back to surgical and tacit and procedural studies, this is laparoscopic hysterectomy. Sophie Knight et al. As in 2018 used the Delphi method to obtain consensus among experts in relevant steps that you should do to assessment what you do during a laparoscopic hysterectomy. And they looked at the feasibility and use of validity of the scale. And so what they did is they had a virtual reality laparoscopic simulator. So you got to do the surgery in VR. And you had 3 different groups of operators at different levels of experience in the teaching hospital. And they used correlations to look at the results. And there was a significant difference between novice, intermediate, and experienced group for their total scores. And they displayed evidence of validity for assessment of technical performance. So essentially what they were able to do here is show that knowledge and information about how to conduct a laparoscopic surgical procedure were much higher in the groups that were exposed to virtual reality. And again, there's paper after paper in this area. I think we get the idea that surgery and VR have a fabulous kind of connection. That's probably we're seeing some of the best outcomes. We then looked at a paper on VR and PTSD in Afghanistan and Iraqi vets by Aaron M. Noor et al. In 2018. The treatment of PTSD is a big issue. We're certainly wrestling it with here at Humber College. We know that paramedics have a high rate of PTSD. Imagine the kind of things an emergency paramedic driver would see in the course of a day. And they take that home with them sometimes. Some of them can't, some of them can. But there is this idea of PTSD. So what we're doing in Humber is we produced a virtual reality casualty simulator, and they're in a subway car after a bomb has gone off, and they have these bodies all around, and they have to connect. And so we're measuring their galvanic skin response and their breath rate, their heart rate, etc., and trying to find ways to control these through enhanced training in the program to try to reduce PTSD. We're just very early stages, and that's the work of Heidi Marsh, our Director of Research here at Humber. So what they did along this line is they took a number of active duty U.S. Army soldiers, about 108, enrolled in a randomized clinical trial comparing virtual reality versus regular prolonged exposure in treatment of PTSD. So prolonged exposure generally is going back and thinking and reliving elements of what happened that freaked you out, that caused the horrible experience, and trying to change your cognitive and affective responses. But VR training would be actually going back in and re-entering the VR world and re-entering different sort of realities that had caused the injury itself. So you have a higher level of immersion. And they identified 18 baseline variables, and they looked at those variables that they were measuring. And patients who was predicted to see greater PTSD symptom in VR were likely to be younger. So so we found that VR did work for producing PTSD. Not in the older combats, but the younger, like in their early 20s. If they weren't taking antidepressants, they seemed to get better results, and they had greater PTSD hyperarousal symptoms, and were likely to have a greater than minimal suicide risk. So it appears that this worked most effectively with people that were worst off and most damaged, except for the age barrier, which is, of course, we can't explain. It's just simply looking at their literature. But again, this idea of using this, sometimes they use a mixture of transcranial stimulation in VR. They're starting to experiment. Transcranial stimulation is spraying electrical current on the brain, and that can help reset some circuits and try to clear with depression and some persistent symptoms of PTSD. So we'll watch that literature, and of course we'll report back as it begins to develop. Another area where VR seems to be promising. We looked here at game-based learning again in another paper by Ann L. Butt in 2018 on game-based learning and haptics. Now haptics is basically have something in your hand that you can use to interact with the virtual world. So this was a mixed method study looking at the reaction to a game-based VR system to practice urinary catheterization. And as you can imagine, I mean, there's a comedian that just said, it was a funny thing, I was driving to work today, and he said, why, they tell me I'm sitting in the hospital, a new nurse comes in with brown hair and says, okay, I have to remove your catheter. He says, okay, I guess we're going for it. She says, well, I want to remind you that I've never done this before. He says, never done this before. Why don't you practice it on a dead guy first? I thought it was funny. His timing was better than mine. But urinary catheterization is nothing to laugh at. Just imagine that you would need to have a fair bit of sensitivity to do this kind of thing and learning how to do it. So they did a study, and they had 20 people in the study, but they found that the usability of the VR system was really easy to use, and they rated catheter insertion this way as highly engaging and enjoyable, not for the person being catheterized, but by the person learning the VR. Subjects using the VR system spent more time practicing and completed more procedures in 1 hour than students who practiced traditionally. Follow-up skill demonstration pass rates between groups were identical at 2 weeks. So again, it's this kind of medical application of being able to take something which is potentially very distressful. And the joke I tried to tell comes back to reality that nurses may not get a lot of experience doing simple procedures like putting tubes down your throat or up your nose or up your for catheterization, and that has a very strong sensitivity to it, and that by rehearsing in the virtual world some of these procedures, they can get a lot more practice before they actually do it, and that has all kinds of great outcomes for the patient. So when people have looked at this work, there's some great work done by Rao and team at Duke University, and this is the idea of sensory motor learning, and this is, again, where the biggest and most promising applications are, according to the author. So sensory motor learning is this stuff like inserting catheters we've talked about or doing laparoscopic procedures. It's sensory motor, integrating inputs through visual and other senses and producing very fine, very controlled responses. So this is looking at the work of archery. And so they were actually using VR archery to develop archery skills. And they found it was very effective. And they looked at rotational speed, acceleration, reaction time, and peak speeds. And these are all described in this graphic. So they looked here at reaction times, and they were able to see that people in VR were able to function just as well as someone who had a real bow and arrow. So it shows that the sensory motor integration can be almost identical in VR. That's interesting to me because sensory motor integration opens up not only surgery, but all kinds of skills that we see in areas like construction trades and electricians' trades, where you've got to be able to do something with your hands, and that has critical time and control elements, and you want to use the VR experience to produce a kind of virtual apprenticeship. And so this is really fascinating to see that this work holds up so well. They all found that the movement kinematics changed using that VR. So they had simulated trap shooting in an immersive virtual environment. They had a handheld controller, that's the haptics, and the target would be shot in the air, and they had to track and acquire and shoot them. And so they measured hand and head movements with endpoint performance, and they did about 350 trials of the training over an hour, and they proved their accuracy by 18%. There's some other work we want to start to conclude with of how do we take learning in VR and make it collaborative. How can we work together in VR? You're wearing your goggles, you're in your own little world, and that has some problems if you're trying to reach 700 students at a time, or even 5 or 10 students, or even 2 or 3. In terms of collaborative learning, how do we work together using the virtual world and being in the virtual world together where we can explore things together and learn? That's a really powerful use. Now, fortunately, there's a group of Scott Greenwald at the MIT Media Lab doing this kind of thing. What they did is remote collaboration of groups. So they used what's called a group-to-group telepresence system with clusters of cameras. And they then transmitted this data over a network and then reconstructed life-size in a shared virtual environment in the computer. They then had 3D video avatars. So there's an avatar of me, David Chandross, talking to you, whoever you are, and we can both see each other. And we can both interact as authentic dynamic representations. And so we have this co-presence, this idea that we're together and learning, and this is the future of it. And this is what we call joint learning experiences in VR. So they eventually developed a projection-based virtual reality system. Someone named Kulik has done a lot of work in this field. And they produced these multiple individual viewpoints for a shared 3D scene so that we could actually have a box that we're seeing, and you and I can walk around the box and look at the box from different angles and share that reality. Believe it or not, this is not well developed, and this is on the cutting edge of collaborative VR. So we can build on body language and dyadic gestures. So we can actually, you can look, you can agree, you can nod, you can point to something, and I can follow those things, and we can interact with those objects for these joint learning experiences. It's very exciting. The best thing we've been able to do to produce here at Humber so far is the idea that you'd have a head-mounted display, your VR camera, with a camera on it. Well, it's not really a camera. I mean, basically the feed goes from the goggles into the computer. So essentially the computer is providing the image you're seeing in your Oculus or your Vive. And that computer, the same image that I'm seeing, is being projected on a screen to a class of maybe 60 or 70 students. So they can see what I'm seeing in VR. And what we would hope is that they could see my blood pressure going up, my heart rate going up, to see how I'm responding, what I'm doing in VR, and that they can learn by watching what I've done. But that's not collaborative learning. This is taking it to a whole new level. It's very exciting. That's it for this week. Our take-home ideas today are that VR telepresence systems permit collaborative immersive learning. Keep an eye on those. Sensory motor learning is the most well-proven area of VR education that we've seen, and that personalized VR systems can be used for behavioral change learning. I think it's great, exciting stuff. Remember, with VR, we're little tiny babies. We've got our first little Ford motor vehicles, and there's horse poop all over the road, and we're eventually going to have chariots and superhighways, but right now it's going to take a little bit of patience to get there. This is David Chandross from the Center for Teaching and Learning at Humber College. Have a wonderful week. See you on the flip side.